Yesterday was World AIDS Day, and as we speak, people living with HIV and AIDS are now demanding both levels of government to allocate more resources towards dealing with emerging challenges in managing the disease, especially in rural areas. In Kitui, people living with HIV cited lack of access to ARVs, saying high poverty levels have also compromised their ability for proper nutrition. In Kisii, Nyamarambe sub-county, adolescents have benefited from counseling and HIV/AIDS care packages from a local organization. This amid concerns on an increase in the prevalence levels.
The plight of HIV patients in the country continues to reverberate a day after Kenya joined the world in marking the day. In Kitui, those living with the virus say decades after the disease was reported in Kenya and various interventions introduced to uplift the life of those living with HIV, there has been little to celebrate.
Hawa watu ambao tunakunywa madawa sababu tembe 60 ni 35,000 serikali inatusimamia. Na tunaambiwa tukule mzuri. Unawezaje kula mzuri ambao nao hakuna kitu ambao nakupatia? Na sisi kama vikundi vile ambao tuliungana tunajaribu kuhimiza serikali na hakuna kitu ambao tunapata.
Mona Thomas, who previously lost 3 children to the virus, says it is important for village ambassadors who volunteer to educate people on HIV to be compensated.
Inaletangwa kwa maofisi ya machief au watu wakumbukwe, tukumbukwe juu tunaumia na hatujulikani. Cause hata stigma iko na discrimination. Kuna some machiefs wakijua wewe uko HIV positive akuajiri hata kwa ofisi yake, atupewe chakula ama upewe msaada yoyote. Na msaada yetu inakujanga na inapewa watu wenye hawafai, tunanyimwa. So
in Kisii, Nyamarambe sub-county, teenagers have benefited from packages from a local non-government organization. The group dispersed Maisha packs which contained personal and consumable items to teenagers, some of whom are living with HIV.
Some things that the youth cannot talk openly in their family setting and in their normal setting and in their normal way of life. So that's why we decided where we can share these issues and discuss and help one another grow.
Health officials in Turkana County say the disease continues to affect a significantly large population, with majority suffering ill health due to lack of proper information to manage the disease.
Managed to identify through the 90-90-90 strategy 9,475 people, meaning half of the 20,000 are still out there. And that is why a day like this is set aside to ensure that we create awareness and encourage the rest of the people to come out openly so that they can be able to be tested for HIV/AIDS and put on care and treatment.
Over 20,000 people in the county are suffering from the disease. In Kakamega, pregnant women have been urged to ensure they know their HIV status to protect their unborn children. This as the number of HIV cases in Kakamega continue to rise steadily, with calls to residents to follow the HIV preventive guidelines to avoid further transmissions. Finally, in Mwea Thiva village in Kirinyaga, young people were challenged to get tested for HIV/AIDS and ensure they protect themselves. Caroline Kamar reporting for Channel 1 Lunchtime News.